Ms. Degette.
Thank you very much, Mr. Chairman. Mr. Chairman, the state of our health care system in this country is unacceptable. It's unacceptable that despite the $2 trillion Americans pay for health care every year, twice as much per person as other industrialized countries, the outcomes are abysmal. Americans often think we have the best health care in the world, but consider this. In terms of women's health compared to other countries, the United States ranks 24th. In infant mortality, we rank 29th. In life expectancy, we rank 31st. And for health outcomes overall, we rank 37th, which is just below the Dominican Republic and Costa Rica and just above Slovenia. Put simply, when it comes to health care, Americans pay so much more, but they get so much less. This is not only morally unacceptable, it's financially unsustainable. It's unsustainable for families who often spend more on medical bills than on food and housing. The fear that just one illness or accident could plunge them into bankruptcy is very real. Medical bills are the cause of more than 60% of all personal bankruptcies in this country, and more than 75% of those people had health insurance. It's unsustainable for businesses, especially small businesses, which have to slash their employer contribution even though they want to do the right thing. It's unsustainable for hospitals, especially safety net hospitals like Denver Health in my district, where a surge of unemployed and uninsured patients have pushed uncompensated care costs above $300 million a year. And finally, it's unsustainable for states, which are overwhelmed by exploding Medicaid costs, including in my own state of Colorado, where the rolls are rising at 33,000 new Medicaid recipients every month. And the status quo is unsustainable for our nation. The more than $2 trillion we spend every year on health care constitutes 16% of our gross domestic product. Over the next decade, without reform, it will swell to 20%. And that's why even the chairman of the Federal Reserve Board, not exactly someone to exaggerate, has called this system broken. There are three provisions that are key in this bill today. The first one is auto-enrollment of newborns into Medicaid so that we can make sure we get kids started out right in the first place. Secondly, the bill reinvests in our primary care workforce in the form of student loan repayment programs and workforce training programs. If we don't do that, we won't have the doctors to treat these new patients. And finally, Senator Whitehouse and I have worked on the National Health Care Quality Act. Many of the revisions are included in this bill, which is critically important. Mr. Chairman, inaction, delay, and excuses have led us here today. If we don't enact comprehensive health care reform to address these in the long run, we cannot meet the challenges ahead of us in the future, and that will be simply unacceptable. Thank you.
Thank you, Ms. Degette.